I'm really excited that this is the third year of the Let's Talk Pain Coalition. It doesn't seem that long ago that we joined forces as a coalition, the American Pain Foundation, the American Academy for Pain Management, and the American Society for Pain Management Nursing to really make a difference and increase the awareness and understanding about pain by talking to patients, people who live with pain, and their providers to better communicate with one another. And just use the simple principle of talking, listening, and acting. You know, talking is so important. We know that people living with pain need to be able to come out of the closet and explain their experience and what their life is like living with pain, and better in an environment that is safe and with unconditional understanding, and more so in a clinician's office than anywhere else. I think it's so important for clinicians to be willing to listen and understand and recognize the biases that we all carry, but move beyond those biases and work together to combine an active communication plan with the person that we're caring for that's entrusted in our care, people living with pain, family members, you know, other healthcare professionals that we're engaged with, as well as the community at large. And together we should be acting. We should be acting in the best interest of those who need their pain managed and managed effectively in our nation, and together become advocates. And we can all be advocates simply by taking that first step.
Well, you know, Mickey, our organization, the American Academy of Pain Management, is an organization that promotes an integrative model of pain care. And by that we mean that it's patient-centered, that we consider the whole person, the mind, body, spirit, the community in which a person lives. We also we look at bringing together a variety of modalities to treat pain. But that's who we are as an organization. But the most important principle of integrative pain management is that we are patient-centered, that the person with pain is the most important person in this relationship, and communication is an essential part of that. We teach about this at our meetings. It's something that we do through our publications. We encourage our clinicians to be there with the patients, to truly be there, and begin this right at the start, right from the very moment that they sit down with their patient, to listen carefully, to find out who they are, not just, well, you know, what's wrong with you, but really to discover who that person is, to figure out how that person, listen to how that person communicates, how frightened they may be when they come in, you know, and they're experiencing pain. They don't know what kind of medications they're going to be on. They don't, you know, and they hear so many things about these medications that it's scary to them, you know, and it's that clinician's job to provide a comforting atmosphere right from the get-go, and to be with the person with pain in a compassionate manner. You know, to let the person know that they're knowledgeable, that the clinician's knowledgeable, but also they need to do it in a sense. I think that we've lost a lot in medicine, you know, that about the relationship, and it's through that relationship that the patient will hear better, the person with pain will hear better. You know, we talk about safety issues, which you're going to talk about, Terry. You know, the person with pain is more apt to hear it as any other message that's being communicated if that relationship is established.
Absolutely.
And the American Society for Pain Management Nursing is so excited to be part of this coalition as well. We look to promote effective pain management for all people in pain. And we look at educating as a big part of our mission, and that education needs to be that patients who, or people who are in pain, have an adverse effect for not being treated. It's devastating for the person in pain to be undertreated, as well as, you know, when we're afraid of safety, we talk about the options for pain management may have safe risks or benefits. Every option has a risk and a benefit, and that's what we need to teach so that we can mix those modalities or those options for an individualized treatment to each person with pain, to make sure that we decrease suffering, increase function, decrease pain, and increase quality of life. And so I, as a nurse practitioner myself, I look at giving full consent to people with pain or to any of the patients in my practice, which means that you look at the risks, you look at the benefits, you look at the alternatives, and you look at the expectations. And you do that whether you're offering physical therapy, whether you're offering an opioid, or whether you're offering acetaminophen. And so all of these options need to be looked at, and we need to be accountable and educated so that we can provide that, what we use the term multimodality approach, in a safe and effective way for all of our people with pain.
I think it's really exciting that this new series is going to be talking on this very issue of open communication between the clinician, between the person living with pain, and talking about risk and talking about how to have safe care with knowledgeable clinicians and knowledgeable people who are taking on those options. And it makes perfect sense that the American Pain Foundation, the American Academy for Pain Management, and the American Society for Pain Management Nursing are part of the Let's Talk Pain Coalition. Thank you, support from Pricaro, so we're able to continue this message and move on, and I hope everyone enjoys this next series.